I will give you some tips how to manage your life, even if you are struggling with vision loss due to glaucoma. There are lots of lifestyle modifications which are coming in, which can be adapted, hopefully, to delay the progress of glaucoma, which I feel might be very helpful in the future, and how not to feel alone and seek emotional and psychological support in your journey of glaucoma. Now, let's have a quick look at this picture, and I'm sure most of you will relate to this thing. So, you are at an age group where you would like to enjoy life as much as possible. So, you may be retired, going to the gym, having coffee with your friends, going out with family and friends. And then you realize that, well, your vision is not so great, and you think that it's going to be a quick fix, and you just go to the optometrist and bam. So the optometrist feels that you have glaucoma. So I totally understand, and we as clinicians understand that it can be scary. And today, in today's world, the first thing which everyone would do is go back and Google regarding glaucoma, because whenever you are given a diagnosis of some disease, you would like to understand more about it. And Google, of course, is the go-to these days. And the moment you type glaucoma, you'll see some captions like sneak thief of sight and irreversible loss of vision, blindness, and that itself can be scary, which we totally understand. But one thing for you to understand is, be it any disease or anything you are dealing with, the first thing is acceptance. Unless you accept the fact that you have a disease or there is a problem, you, of course, cannot take control over it or cannot cure it. So the first thing is to accept that you have glaucoma. And the other thing to remember is, yes, glaucoma cannot be cured, but we definitely can treat it. So here we are not after treating the disease, we are after treating the patient. So the goal of glaucoma treatment is to outlive your glaucoma. I'm not bothered whether your pressures are 24, it is 30 or 40, as long as I know you will be able to see till the time you live. And that is the main aim of glaucoma. It's not just treating the pressure. So, as I said, the beginning starts with understanding the disease, and it is applicable to both. So, what actually is glaucoma and how does it affect the eye? Now, this is a metaphor I give to all my patients. Just imagine your eyeball as a sink. Okay, so you have fluid coming in from one side and you have fluid exiting from the other side. So if there is an imbalance of this fluid formation and exit, which may, for example, there might be increased formation or there might be a blockage to the exit of this fluid, what is likely to happen is the pressure inside your eye or this thing will increase, right? And what happens when this pressure builds up inside the eye is it affects the nerve fibers, which is located behind the eye, which is the optic nerve. And how it affects you is you tend to have blurred or missing patches of visual loss in your visual field. Initially, it may be very negligible. Not many patients realize that they have field loss until you go ahead and do this test, which tells us, well, parts of your fields are missing. Now, the problem with this field loss is it is irreversible. So whatever field loss you present with, it cannot be reversed. But as I said, the idea of treatment is to try and prevent the field loss to progress to a state which would result blindness in your lifetime. So when we talk about pressure, what is a normal intraocular pressure? And this is a question which everyone will have. And they come out with the magic number of 21. So is it like if your pressure's at 21, you have if your pressure's at 22, you have glaucoma, and if it is less than 21, you don't? Probably not. Now, the magic figure of 21 has come out from a study which was done by Ledecker, and he saw that most of the humans do not develop any optic nerve damage till the pressure remains within a range of 10 to 21. And that is how he came out with that the normal intraocular pressure of an individual is the highest is 21 millimeters. But giving an example, so we see three different stages of glaucoma. This, as you can see, is an early stage. There's some amount of moderate damage. You already have this amount of field loss. And if you can see, this is an advanced damage. So the magic number 21 probably doesn't fit everywhere. So if you are diagnosed with a severe glaucoma at presentation, the intraocular pressure for you, a 21 pressure, is not normal. So that is the concept of a target intraocular pressure. So what is the target intraocular pressure? It actually is a range of intraocular pressure which will prevent any further progression of glaucoma. And hence, the target intraocular pressure is different for different eyes. Forget about patients. Even with the same patient, you will have a different target for the right eye and for the left eye, depending upon what damage they already have and how much is their lifespan. Because remember, as I said, the main idea of treatment is for you to see till you live. So now we understand that physicians, we have great power, but we do understand that with great power comes great responsibilities. So coming to the responsibilities of a doctor, patient education is the key. So this is a disease where I believe if each of you today go and speak to four of your friends regarding what you learned about glaucoma, I mean, that's going to go heaps and bounds in spreading awareness about glaucoma, because early diagnosis is the key. And for that, you have to understand about the disease, what are the treatment options available to you, and what is the usual follow-up pattern which you need to follow in case you have glaucoma or are diagnosed to have glaucoma. Then it is our responsibility to listen to you, to listen to what you say. We can write 10 drugs, but doesn't help if you are not able to use them. So listening to the patient, understanding the patient's needs and how to deal with it is a part or a big responsibility a doctor holds. Then it is also his or her responsibility to ensure that she remains available during the patient follow-ups, and if she or he is not available, to provide suitable alternatives wherein the patient can visit for their follow-up. Now, responsibilities of the patient. So what is expected from your side? The first thing is having confidence in your doctor. Now, sometimes you get confused and you feel that you do not trust the doctor. It is always good. There is no harm in taking a second opinion if you are confused or you feel that probably no, you do not agree with what was told to you. There's no harm in getting a second opinion, but once you select your doctor, my recommendation is stick to that person. So have confidence in your doctor. Keep a track of your appointments, and this is very busy, very important in this busy, particularly in the public system, because sometimes you fall back in the system and that is no one's fault. It's just become so busy that someone is not able to keep track of your appointment, and it's perfectly normal for you to call up the hospital and say, look, I was supposed to be seen in 4 months, but I am waiting since 6 months and I haven't received a call. That is perfectly normal. write down your questions or concerns, because as we know, we have a 15 minutes appointment slot. So it is very difficult to address everything or think and ask whatever you want to ask within the 15 minutes. Sometimes you just come to an appointment and just walk out of the door and you remember that, oh my God, I just forgot to ask this. So it is a good idea to, when you know that you have your appointment, just write down all your questions and concerns so that you can ask the doctor each and every point, clarify it before leaving the room. Now, the fourth point, which is very important. Do we have any questions here? Okay. The other thing which is very important is to report any adverse effect with the drops. Now, when we prescribe you a drop, so allergy, any patient can be allergic to any drops. Now, we as clinicians won't know unless you have a background history or you have taken the drops and have noticed some side effects. It is always good to call up and say that, look, I have been prescribed this so and so drug and I'm having this problem. It's always a doctor can switch, give you an alternative. So once you have been prescribed a drop, do not stop the drop on your own. If you're having any adverse effect, it is a good idea to call up and inquire that what is the next step. So cost, of course, may not be issue in this country, but there are certain drugs which are not generic, and sometimes you are unable to pay for it. That is perfectly normal. But you have to tell your doctor that you are not able to afford these drops because of the cost. Okay? Then we understand that you are at an age where forgetfulness is quite common. And even otherwise, even now we forget lots of things. There are several things in your mind, and sometimes you forget to put the drop. Once or twice is okay. But if it is happening habitually, then something needs to be done regarding that. Okay. And the doctor can help you with this if you tell the doctor that you do not remember to put your medicines every day on time. And they hopefully, once they know, will be able to give you ideas how you can remember. And if they feel that it is becoming a problem, they'll give you suitable other alternatives. The other thing is traveling, which has become very common after COVID. Once COVID has ended, everybody wants to travel. Again, very good. But let us know in advance, because certain drops, they need a cold chain maintenance. So if you have to travel for the next 3 months or next 2 months and you are not able to maintain the cold chain for the drops, it's always better to tell your doctor so that they can give you suitable alternatives. Now, coming to the risk factors which are involved with glaucoma, the most common age is the most common risk factor. And today, in today's concept, I would say intraocular pressure itself is a risk factor. Okay. So anyone above 40 years is likely to develop, likely to have glaucoma, but it also depends upon whether you have family history or you have other problems as short-sightedness. If you are diabetic, you are more prone to develop glaucoma. If you are taking steroids for whatever reason, for your asthma, for allergy, again, you're more prone. There are certain drugs which can give rise to glaucoma, and steroids are one bulk of them. And if you have a trauma of any sort, there is a chance that you might develop glaucoma. Now, coming to what are the types of glaucoma and is it important? Yes, it is. So if we go back to the metaphor of the thing, so in glaucoma, basically we have two major types of glaucoma. We say it is open or closed. So either you have an open angle glaucoma or a closed angle glaucoma. Now, how are these two different? So if you go back to the sink, so every sink has a sieve, right? So what happens in open angle, you have to remember the pores of this sieve is slightly narrow or blocked. So this is an open angle glaucoma. But in closed angle glaucoma, what happens is the exit pathway of the sink is totally narrow. So why this is important? Because in the first option, wherein you have the sieves narrow, but it is still draining. So what essentially happens? There is a slow buildup of pressure, and it is better in terms of not having an attack, but this glaucoma or the open angle glaucoma is dangerous in the sense that you do not realize that you have glaucoma because you are asymptomatic. You do not have any symptoms. So the pressure buildup is very gradual until and unless you go to an optometrist or go to for checkup, you do not realize that the pressure is high. You don't feel anything. On the contrary, the second option where the exit pathway is narrow, that sometimes occur because the exit pathway is very narrow, suddenly there is a buildup of pressure. And what you can present with is known as an acute attack of glaucoma. So your eye becomes red, you have severe pain, you start vomiting, there is sudden vision loss. And unfortunately, no one wants to go develop this attack because this can result in potential loss of vision, which could be irreversible. So what are the treatment options available today? So we have a drug-based approach, so in which we use various drops to bring down the pressure. And then you have a surgical approach, which there are lasers, which are minimally invasive, actually, very non-invasive. And then you have the major surgery for glaucoma, wherein another pathway needs to be created to drain the fluid. So what are the advantages of drops? Because it's the most common thing which is sought after. Well, the first thing is it's non-invasive. It's an easy option considering we can start the drops and we just have to continue with it. And it is not because it's usually funded and you don't have to pay from your pocket. So it's like putting it's adding something into your daily schedule. Now coming to the adverse side effects of the drop is compliance is a big problem. Now, as we talk, like you may be forgetful, you do not realize, and whatever drops you put, all you see is the side effects of the drop. You see redness in the eye, you see the eyelashes growing, but you do not know whether this drop is acting or not unless you go to a doctor to check your pressures, right? So what you essentially see are the side effects and not the benefits. So it is not very motivating factor for you to keep doing the drop. Sometimes few of patients have rheumatoid arthritis or some joint problems, and trust me, the bottles sometimes are very difficult to squeeze, which we understand. Okay, so if you have a problem with installation of the drops, do let your doctors know. Then, as I said, you might have storage problems. And if you do not remember, one good way is to keep the drops just before your meal, be it breakfast, lunch, or dinner, depending on how many times you have to instill the drops. So if you time it with the meal, usually you always remember to put the drop before going to it. And the other thing concerning is the local and systemic side effects which the drops can cause. Well, it comes as a package deal. This cannot be separated. Some drops causes dryness of the eye. The eyelashes grow long. Some people develop severe orbitopathy wherein the eye appears to be sinking inside with long-term use of this drop. And these are the unfortunate part, and then you can have systemic side effects. Some drops causes difficulty breathing, some causes irregular heart rhythm. So these are the side effects which you usually have with the drops. Now, one way to reduce the side effects is after what is known as the punctal occlusion. So after putting the drops, you hold your eyes in the inner side of the eye for 2 minutes, and that is what is the punctal occlusion. So this essentially helps the drop to remain within the eye and not get absorbed to the systemic circulation. So one of the newest method which has told and which that say that you don't have to wait for 2 minutes to hold. You can take a tissue, put some drops, cover the tissue for 30 seconds, and that itself should help the drop to remain within the eye. The next option in the treatment line is lasers. Well, lasers are not real surgery. They are very non-invasive, and these days we have various different kind of lasers, very modified, and with technological advances, the lasers really work well. So in my practice, I usually I don't like the side effects from the drops. So I keep laser as a first option, as a go-to first option, so that if it acts in you, it helps us to keep you away from drops for a longer period of time. So how does the laser act? So now you have two different types of laser for two different types of glaucoma. So if you remember the open angle, as I said, the pores of the sieve is narrow. So what this laser does, it kind of increases the size of the pores. Okay. So the healing of the body is there. So it will always try to constrict back, but still we try and enlarge the pores. And even if they remain open or big till 6 months, the pressure is usually controlled. It may remain there for 6 months, 1 year, 2 years. It is different in different patients depending on the healing power of the patient. And the good part of this laser is it is repeatable. So if we have done a laser and it has helped you to bring down your pressure, we can keep you off the drops, get you back, check your pressures, and the moment we feel that the pressure is started going up, we could possibly repeat the laser. The other option for the angle closure or the closed angle glaucoma, what we do is the laser. If you remember, I said the exit pathway is narrow, right? So what we do is we create an adjacent or a tertiary pathway. It's like a bypass track. So we just create a hole in the eye, creating a bypass track for the fluid to flow away. So in the future, this will help you prevent developing of an attack as well. So what essentially it does, whenever there is a sudden buildup of pressure in the eye, the bypass helps to channelize the fluid, and that helps to prevent you from an attack. And from treatment point of view, it may or may not help to bring down your pressure, but it will definitely prevent the progression of glaucoma. Once this procedure is done, we can treat you as an open angle and try to treat you with the other options which are available for open angle glaucoma. So as I said, lasers are relatively safe. They are a replacement to your drops. They can be repeated and it is funded in the public system. The only cons I would say with the laser is few patients do not respond to the laser. So if you don't respond well to the laser, there is no point in keep on repeating the laser. You have to be shifted back to your drop. And the last option, which we usually don't encourage until and unless you are in stage wherein your pressures are not getting controlled on the first two options, is surgery. And in the eye for glaucoma, what we do is known as trabeculectomy. Now, trabeculectomy is a filtering surgery wherein we create a trap door on the white part of the eye and kind of channelize all your fluid through that. So the advantages of this surgery helps to achieve very low pressure, which is usually required in case of an advanced glaucoma. As I said, the target is different in advanced as compared to a mild glaucoma. The side or the cons of the surgery is it is unpredictable. So we don't know what is the tissue healing capacity of the patient. So it actually works different in different eyes. The same procedures might give very good result in one eye, whereas will give a different result in the other eye. Now, in between this drug and this uh, trabeculectomy or the main filtering surgery, these days what we have is a minimally invasive glaucoma surgery, and this is something which is very close to my heart. And I just feel that it helps patients to kind of recover much better. So these are either in form of stents. This is what we are mostly using in New Zealand. So you have small stents which can be fitted into the angle of the eye, and they help in draining of the drainage of the fluid. So if in your mild and moderate stage, if we are able to instill this treatment, we can keep you off your drops for a longer period of time. It will prevent you from developing the ocular surface side effects which the drops create. And sometimes it just helps to keep you off the drops, but sometimes if you are on many drops, it helps to reduce your drops. And it will definitely delay the requirement of for a filtering or a trabeculectomy surgery. Now let's talk about lifestyle modifications. So lifestyle modifications is showing really to be beneficial in all fields of health, and so is in glaucoma. So with nutrition, the green leafy vegetables and the citrus fruits are the most identified nutrition, which healthy nutrition, which has shown to be beneficial in many glaucoma patients as per various studies. The problem is we do not have any randomized controlled trials. So there are small studies, but most of them have shown that the green leafy vegetables are and the citrus fruits, because they are high in antioxidants and they are high, uh, so that is how they are very good for the optic nerve, and they are slightly protective for the optic nerve. Coffee, on the contrary, has shown to result in a high intraocular pressure, be it immediately after taking a cup of coffee, or if you're taking too much of coffee, that can cause a raised intraocular pressure. Smoking as well causes, it reduces the circulation of the optic nerve somehow and causes more damage to the optic nerve, mostly if you already have glaucoma. Well, there are a couple of studies which had shown that marijuana was beneficial, but I would not kind of promote it because these are very small studies and no definite relationship has seen that of marijuana to be helping in patients of glaucoma. The other thing which has mostly studied is the ginkgo biloba extract. We have it in New Zealand as well. Unfortunately, it is not funded, but it does not cost much. These are extracts which studies have shown in few patients who are progressing despite their medical management or the lasers or everything. Their intraocular pressures are low, but still their fields are progressing. Ginkgo biloba has shown some beneficial effects in these patients. Now, coming to exercise, there are few exercises, mostly the dynamic one, which helps reduces the intraocular pressures. Running and walking are good for reducing intraocular pressures. The effect of aerobic exercise has also been found to be good and long lasting. Swimming is another good form of exercise which is helpful in reducing the intraocular pressure. A word of caution is, however, for the swimming goggles, which can create an increase in pressure if they are very tight on your eyes. And the other thing is, yes, we tell it to every patient, you are not allowed to swim immediately after any kind of surgeries of the eye, and that includes glaucoma surgery as well. So yoga and meditation there are lots of studies which are being done in India because they are showing beneficial effects in glaucoma patients. The only thing in yoga, there are certain postures which can aggravate your glaucoma, and anything like the downward dog posture or anything that needs some Valsalva maneuver. those are the one which raises the intrathoracic pressure and can increase your intraocular pressure. So if you have glaucoma, it's better to avoid those. Now, there is a condition called pigmentary glaucoma wherein you get release of pigment. In those patients also, any form of weight training or any form of this kind of yoga are a strict no-no. Meditation helps eliminating stress and has been to help in your glaucoma as well. Now, with sleep, there are various things. What has been studied, and these are again various very small studies. So sleeping back on your pillow is the best posture while sleeping. It was seen that patients who are sleeping on one side and that side was found to have a raised intraocular pressure. Also, in mostly while you are sleeping, your diastolic blood pressure falls. So if you are a hypertensive and taking your PP medications at night and you're progressing, we often ask you to get in touch with your GP or physician and try to take the medication in the morning, so that at night time, as it is the optic nerve head circulation is low, you don't want to further reduce it. Now, this is one thing, and this is the reason why we are here on this platform. And Glaucoma New Zealand, I would say, is a good platform for us to come together and not feel alone. So if you have glaucoma, that is okay. It is okay to share your feeling. It is normal sometimes to feel depressed or scared. We all do feel that. So you just have to, as I said, accept that you have a problem. Then you have full control over your problem so that you can continue to live and enjoy what you do. You join various support groups because you will hear patients sharing their stories. It in a way is motivating. It makes you feel that you are not alone. There are many patients who have this, and it is okay to have, and but you can outlive it, and that is the positive side of it. So educate yourself as much as about glaucoma. As I said, if you can share what you learned today, even to one or two, three people, there it goes a very positive way in sharing awareness regarding glaucoma, and it will definitely help everyone to get control over their glaucoma. So share your story with your friends, families, and I'm sure that they are going to be very supportive when they know that what you have to deal with or you're going through. So just to recapitulate, what you need to know is the type of glaucoma you have, and it is okay to ask your doctors this. The type of glaucoma you have, because your treatment depends on that. What is the target intraocular pressure? Are you able to achieve the target intraocular pressure? What are the treatment options? What are the follow-up schedules you should follow, and what activities you have to avoid? So if you already have low vision with glaucoma, there is nothing to worry. I usually get my patients in contact, get in touch with the Low Vision Foundation, because they guide you through how to live or how to navigate when you have low vision. There are various devices which helps you through to study or read or do your daily activities using those devices. Join the support groups, as you say, and every time you see someone comes back with something very innovative and which you find that very helpful to you, and don't forget the other eye. So if there is blindness in one eye, the other eye is acting, and usually the other eye kind of helps this eye to move around, even with your driving or anything you do. So the other eye always compensates for this eye. So don't forget the other eye. Rely on your family members. Share with them so that they can help, or help them to help you better, I would say. So what are the big do's of glaucoma management? Have regular eye examination, eat healthy, Take your medication every time on time. As I said, a good way is to time it with your meals. Exercise regularly, that might help to keep you motivated and keep your glaucoma under control. Now, if you have glaucoma, please do not do this kind of postures because it's not helpful. Try avoiding coffee if you can, switch to tea. Green tea is good. And as I said, avoid smoking because that sometimes is very progressive and can cause harm because of glaucoma. So don't forget that glaucoma, yes, is the leading cause of irreversible blindness, but the best way to prevent it is early diagnosis and management. So it's just to be mindful of the risk factors and the do's and don'ts of glaucoma to prevent any progression. Thank you very much.